Start the clock. Next question, the member for Ottawa South.
Thank you very much, Mr. Speaker. My question is for the Deputy Premier. Today is Advanced Care Planning Day across Canada. It's an important day for people to think about what's important to them at the end of their lives. We don't want to think about it, but it's very important, not just for ourselves, but for the ones that we love, the people who live with us. So when I look at this year's budget, I see that alcohol, beer, or wine is mentioned about 50 times, and the words palliative care and end of life aren't mentioned at all. What I do know is we don't all drink, but we're all going to die. And I know that there was money put forward in the 2018 budget to support advanced care planning, very leveraged money. It was in the hundreds of thousands of dollars. That money has never flowed. Will you commit today to flowing that money for advanced care planning?
Deputy Premier.
Well, I thank the member very much for the question. I know the member from Ottawa South you've done a lot of work on palliative care and end-of-life care. That's important to you. It's important to me as Minister of Health and Long-Term Care, but most importantly, it's important to the people of Ontario. No one wants their loved one, when they've been deemed to be in a palliative state, to spend their last days in hospital in a clinical setting. They want them to be in a warm, comfortable place where they can receive appropriate pain medication, whatever else they need for their last few days. We have flowed significant money into creating more hospice care spaces in Ontario. That is expanding across the province in many communities. It's important for all of us because not everyone can die at home. The hospices are performing great work. I've had the opportunity to visit a number of the hospices, and they do whatever they can to make a person's last days comfortable, including bringing in animals in some cases, whatever it is that makes that person feel comfortable and safe and spend their last days in comfort. So I will say—
Thank you very much. Supplementary.
Thank you, Speaker, and I thank the Minister for that answer. And I do have to say I appreciate that the work is continuing on from the work that was done at 16, 17, and 18 to invest in palliative care and hospices. So I'm glad the government did not stop that work. I appreciate it very much. I do want you to commit to that money for advanced care planning. I think it's very important. It's very highly leveraged money. There's also a movement that's across Ontario in about 11, 12 cities called compassionate communities. And that's in my city of Ottawa, former Mayor Jackie Holzman and Jim Ninninger, largely a volunteer, actually a totally volunteer-based organization, are trying to make our communities more friendly, not just for people at the end of their lives, but for frail, elderly seniors. And there's an investment in the last budget as well, too, to support that. That investment has not flowed. It did not move. I would like you to make a commitment to do that as well. It's very important, very leveraged money that supports people at the end of their lives or when they're at home, and they're old and they're frail and they're seniors. So I'd like you to commit to both of those things. Thank you.
Thank you. The response?
Well, what I can say to the member is this continues to be a very important issue to us at the Ministry of Health and Long-Term Care. We are going to continue to invest in hospice care funding, but we're also going to invest in home care funding. We're spending an additional several $100 million in home care funding, and what I've heard in my travels as I've been visiting communities that are already providing integrated health care, that there is a big commitment to making sure that we can also provide palliative care at home. So the home care workers are very keen to do that. They want to make sure that they can help people spend their last days at home if they're able to, and many families can do that. Some cannot, but for the ones that can, we want to make sure that the home care workers have that additional training to be able to provide those services, and that is truly patient-centered care. That's what we're trying to build in Ontario. So we're going to continue with those investments.
Response. Thank you very much.